What if we didn't have the equipment that we had here today, which means we wouldn't have a lot of the talent that we had here today, and we wouldn't have the services that we have here today that you'd have to go somewhere else to get, and the programs and the supports that the foundation is involved in and supports and funds. What would we be without all that in the community? I think that's what I would tell the community.
The people that give, who donate to the foundation, they're not doing it for any glory, for any accolades. And I think the foundation has those similar values as well. And so I think sometimes very quietly they do their work in the community, but it's time, 40th anniversary, it's time to recognize that. There's a lot of beauty in that, and it's exciting.
Healthcare is important to all of us, and without our community to support it, we wouldn't have what we have here today. If you go back to the beginning where those gentlemen came together just because they felt there wasn't going to be funding, they knew the government couldn't fund everything. So for them to come together and make that happen and then rally a team to go out and fundraise, and they had hired a company at the time for fundraising, and that fundraising company said, "You're not going to raise $5 million.
It had to be an endowment fund. The vision of the foundation was to capture the magic of compounding and the time value of money. The whole foundation, in my mind, was built on the concept of trust. Part of this whole endowment fund in growing the capital would be part of the brainchild of Jim Gogan.
When we first started getting the lists from the hospital and trying to figure out what it was that they needed, the list was pretty small and pretty insignificant, but it was important at the time. And as we went on, the list just kept growing and the needs got bigger.
We had a few very long-term and wise directors who ended up deciding that perhaps we should restructure the organization to have more flexibility in supporting the healthcare needs of Pictou County. It involved, of course, totally changing the actual structure of the foundation itself. We went from having the Aberdeen Hospital Foundation and the Aberdeen Hospital Trust, and we became the Aberdeen Health Foundation, incorporating the Aberdeen Hospital Foundation and Trust in under that umbrella. Preventative health care and community health care were emerging as a result of all the research that had been done on the social determinants of health. So it enabled us to open that whole aspect. So that was a big, big reward. We were very happy about that.
It takes a very long time to build trust, but a couple of wrong decisions around a table like ours, you can erode it and destroy it very quickly. So therefore, all the decisions were very thoughtful over time.
We started to develop relationships with helping support organizations in Pictou County, and we all know how many amazing ones we have, and if there are needs, we want to be aware of them.
Having the Aberdeen Health Foundation as our backbone funder has enabled us to do the work that we are meant to do.
As I was coming up through as a clinician in this community in Westville and in the Aberdeen Health Foundation was always a big part of that. We could really see the investments and the impact it's had day to day in my work in community and the hospital. Community generosity was translated into impact.
Whether it's the little girl bringing in her birthday party money, or maybe a senior who decides to make a legacy donation or something in their will. Those kinds of people, they want to know that their money is, first of all, especially in this world, that their money is safe, that it's going to be invested wisely.
When my wife, she went into palliative care in January of 2020, we were rather naive as far as hospitals concerned. Janet had been in once, and I hadn't been. So it was all new to us. With the care that she received when she got sick with cancer, it was amazing. The care that we got from Dr. Lee, and then that just carried on in the palliative care unit. Once in a while I'd feel a hand on my shoulder, and a nurse, they weren't just looking after her, they were looking after me too. 5 months later, Janet passed, but it was during that 5 months that I became very aware of the benefit of palliative care. It was an easy decision to make a donation to the foundation.
I think honestly I wouldn't be working here if the foundation hadn't made the Aberdeen as an early adopter of technology. So this was one of the rural regional hospitals that had an MRI, had a fully integrated laparoscopic suite. We've emerged as a leader. We are seen amongst the foundations in Nova Scotia as one of the innovators, leaders, collaborators who make things possible.
Really got to appreciate the place that the Aberdeen Health Foundation holds, not just in this community, but in the province, in terms of really defining what a health foundation can do, how health foundations can be thinking about the entirety of people's health, as opposed to just investments in infrastructure.
If I had one word to describe the foundation, it would be impact.
Impressive.
Indispensable.
I would say they care.
Visionary.
Compassionate and transformative.
Leader, innovator.
You're committed to it, and so far you've carried through with your commitment.
Trusting.
If I had one word to describe the Aberdeen Health Foundation, it would be possibility.